The top stories tonight in Y News. The Philippines breaks its record for the highest single-day increase with more than 7,000 new COVID-19 cases.
The Interagency Task Force orders the temporary closure of cinemas and other tourism-related establishments in general community quarantine areas.
Several European countries have decided to lift suspensions on the AstraZeneca coronavirus vaccine following safety guidance from the European Medicines Agency. The Philippine FDA has granted emergency use authorization to Gamaleya's COVID-19 vaccine, Sputnik 5.
Malacanang has clarified that the calls for the Duterte tandem in the 2022 elections are not from the government.
And a UP scientist joins a historic expedition to become the first Filipino to reach the third deepest spot on Earth. Good evening, Philippines and the world. Today is Friday, March 19, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The Philippines has set a new record for single-day coronavirus disease cases as the Department of Health reported more than 7,000 new coronavirus infections today. In its latest bulletin, the DOH announced 7,103 fresh COVID-19 cases, taking its tally of cases to 648,066. Of the total, 73,264 are active cases or patients who are still undergoing treatment. The previous record high was 6,958, reported last August 10, 2020, the time that the Philippines experienced a surge in cases, pushing the healthcare workers to call for a timeout as the hospitals got filled with coronavirus patients then. The DOH also said that 13 new deaths were reported, pushing the total number of fatalities to 12,900. Meanwhile, 390 new recoveries were also listed, with the tally of survivors jumping to 561,902. Amid this development, the health department urged the public once again to strictly adhere to the minimum health standards to avoid being infected. Due to the rising number of COVID-19 cases, the national government has decided to temporarily close some of the newly opened sectors in areas under general community quarantine. Rosalie Cos explains why.
Starting today, March 18 until April 4, the operations of driving schools, traditional cinemas, video and interactive game arcades, libraries, archives, museums, cultural centers, limited social events in accredited establishments of the Department of Tourism, and limited tourist attractions except open-air tourist attractions in general community quarantine areas will be suspended. Essential business and religious gatherings are limited at 30% venue capacity, but local government units can allow higher venue capacity, not exceeding 50% based on the conditions in their localities. The venue capacity of dine-in restaurants, cafes, and personal care services is also reduced to 50% capacity. National government agencies are encouraged to defer the conduct of non-critical activities that would entail mass gatherings. Cockfighting and cockpit operations are suspended even in modified general community quarantine areas. Meanwhile, local government units shall have the authority to impose a higher age limit for age-based restrictions for minors. Malacanang is confident that through these efforts and cooperation of the public, further transmissions of COVID-19 will be prevented.
Sinusubukan po nating ipababa talaga ang numero ng COVID cases na hindi po nagsasarado ng malawakan ng ating ekonomiya. So ang inaasahan po natin ay ang kooperasyon ng lahat at sa pamamagitan nitong latest decision ng IATF, baka naman po mapababa natin.
The government is strictly monitoring the COVID-19 cases and healthcare utilization rate, especially in Metro Manila. Meanwhile, the National Task Force Against COVID-19 has revised its guidelines on the implemented travel restrictions. In a memorandum released today, the NTF announced that migrant and non-migrant Filipino workers will be allowed to enter the country beginning March 22. The revised memo also allows the entry of some foreign nationals. From March 22 to April 21, entry of Filipinos and exempted foreigners will be limited to only 1,500 arrivals per day. The revised guidelines were issued amid the surge of COVID-19 cases in the country. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The UP Octa research team is proposing the implementation of either a hard general community quarantine or soft modified enhanced community quarantine in the country. Joan Nano tells us why.
In order to slow down the current 1.9 reproduction number of COVID-19 cases in the country, the UP Octa Research Group is proposing to the local government to implement their so-called hard GCQ, limiting the mobility of the people, which according to them is a big factor to slow down the surge. Under hard GCQ, which is proposed to run from 2 to 3 weeks, operation of government offices and industries will continue but will limit the number of allowed workforce by shifting some of their employees to work from home scheme or might impose staggered work hours. Social gatherings will be highly discouraged, especially in enclosed areas such as discouraging indoor dining. Resumption of quarantine passes for persons outside of residence. However, mass transportation should be available for all workers. But if the reproduction numbers fail to slow down, Professor Ranjit Rai, a member of the Octa Research, says that this is the time the government should consider the soft MECQ.
Right now, our position still holds na we have a hard GCQ, a very strict one, and that if the R continues to escalate, then we go to MECQ. But we want a softer version of the MECQ where you have transportation, where you have support for our workers, where arrangements are made so that certain establishments will remain open.
Meanwhile, the experts are also recommending to prioritize residents in Metro Manila and Calabarzon on the government's vaccination program. This is to avoid further transmission in high-risk areas. However, this should be done once the government vaccinated all the health workers as well as those who belong under the priority groups.
We cut off the head first, no, and see if how this will drastically reduce, no, infection. So this is a proposal. Our plan should be flexible. It should be calibrated every now and then to look at the situation in the country.
Apart from the imposition of either hard GCQ or soft MECQ, Octa Research Team is also advising the LGUs to intensify their testing, trace and isolation capacity in order to mitigate the surge, as well as restricting their border controls to suppress further viral transmissions. Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, National Task Force Against COVID-19 Chairman and Defense Secretary Delfin Lorenzana says the government has not yet discussed the implementation of a stricter lockdown following the further rising of COVID-19 infections in the country. Despite this, Lorenzana encourages local government units to strengthen their enforcement of health protocols in their respective areas. Leah Ilagan explains why.
National Task Force Against COVID-19 Chairman and Defense Secretary Delfin Lorenzana has observed that some local government units have been lax in their implementation of health protocols. That is why Lorenzana is putting the burden to the LGUs to prevent the further rise of infections in the country.
Napapansin namin na medyo nag-relax din sila sa pagpa-follow up ng mga enforcement ng health protocols. And so we are throwing it back to them. Kasi we told them that kung hindi nyo gagawin yan, ay magla-lockdown tayo. Mahirapan din kayo, mahirapan ang lahat.
Lorenzana admitted that the increase in COVID-19 cases in the country is alarming, but the government has no discussions yet on the implementation of a stricter lockdown. Yet hospitals will be carrying the burden if the number of infections will continue to rise.
If this continues, our hospitals will be overwhelmed. So ngayon, umaiyak na yung mga hospitals natin dahil puno na yung kanilang COVID wards.
Health Secretary Francisco Duque III has already directed hospitals in the country to increase their COVID-19 beds from 20% to 35% to accommodate the new cases. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
A dozen European countries are set to resume their vaccination rollout of AstraZeneca COVID-19 vaccines, still after multiple reports of blood clots after vaccination. Early Briones tells us the details why live. Early, what are these countries?
Good evening, Diego. Germany, France, Italy, Spain, the Netherlands, and at least 7 other countries said they will resume vaccinations with the AstraZeneca vaccine against COVID-19 after the European Medicines Agency, or EMA, declared its initial investigation of possible side effects, has concluded the vaccine is safe and effective. At a press conference this afternoon, EMA officials said their inquiry could not rule out a connection between the vaccine and a certain unusual clotting and bleeding disorders, but they concluded that the benefits of the vaccine clearly outweigh the risks.
And the evidence we have is at the moment not sufficient to conclude with certainty whether these adverse events are indeed caused by the vaccine or not.
This is a safe and effective vaccine. Its benefits in protecting people from COVID-19 with the associated risks of death and hospitalization outweigh the possible risks.
The agency will add a warning to the vaccination product information to alert patients and doctors to the potential side effects, which appear to be extremely rare. Diego?
Thank you, Early Briones, reporting live from Australia. Meanwhile, U.S. drug company Moderna has begun testing its COVID-19 vaccine on children. Mariel Latoza explains why.
Kids ages 6 months to less than 12 years old have received their first doses of Moderna's COVID-19 vaccine as the company studies the safety and effectiveness of the vaccine for children. In the study, researchers will give 2 injections 28 days apart of either the Moderna vaccine or a saline placebo to the children. Kids who get the vaccine will receive one of 3 possible doses from 25 micrograms up to 100 micrograms, the same dose that received an emergency authorization for use in adults from the Food and Drug Administration. To monitor the vaccine's effects on children, doctors will check in with families through 2 telemedicine visits after each injection, followed by monthly check-ins. Parents will also be asked to make diary entries on their smartphones. Moderna plans to enroll roughly 6,750 children in the United States and Canada for the study, which is taking place at sites in at least 8 states, from Arizona and California to South Carolina and Texas. Mariel Latoza, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching us on the UNTV News and Rescue 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. The Philippine Food and Drug Administration, or FDA, has issued an emergency use authorization to Russian pharmaceutical firm Gamaleya for its COVID-19 vaccine Sputnik V. Meanwhile, the health regulatory agency says the Philippines has no capability yet to produce its own vaccines. Aiko Miguel explains why.
Russia's COVID-19 vaccine Sputnik V Gamcovac can now be used for inoculation in the Philippines. This as Food and Drug Administration Director General Eric Domingo announced this morning that Gamaleya Research Institute's emergency use authorization is approved. It appeared on Gamaleya's interim data phase 3 trials. The 2 doses of Sputnik V Gamcovac has an efficacy rate of 91.6% against COVID-19 for 18-year-olds and above. This means it can be given to senior citizens like the COVID-19 vaccine of AstraZeneca and Pfizer-BioNTech.
It is decided that all conditions for an EUA are present and that the benefit of using the vaccine outweighs the known and potential risks.
Aside from senior citizens, the vaccine can also be administered to those with comorbidities, but should have clearance from medical professionals. Screening should also be done before the inoculation.
Patients, for example, with diabetes and hypertension na controlled, pwede yan. Kapag wala namang acute illness at the time, pwede yan. And a complete history and physical exam will be done. The good thing, like I said, with the Sputnik V vaccine is that a lot of the 25% of the trial participants actually had comorbids, and they also did quite well with the vaccine.
The second dose of Sputnik V Gamcovac should be administered after 3 weeks. To date, the FDA has issued EUA to 3 other COVID-19 vaccines, the Pfizer-BioNTech, the AstraZeneca, and Sinovac Coronavac. Meanwhile, the Philippines is open to other countries like the Serum Institute of India, who is willing to help the country develop its own COVID-19 vaccines. But currently, the Philippines doesn't have enough resources for the vaccine development. FDA says DOST spearheads the discovery of possible treatments against COVID-19.
At this time, we don't. We used to have a vaccine manufacturing program, pero matagal na panahon na yon. And at this time, we don't. And I think during this pandemic, it has been, I think this is one of the realizations that all vaccines kasi talaga in the Philippines are imported. At wala tayong self-sufficiency when it comes to vaccines.
The FDA also warns those who are selling COVID-19 vaccines as reported on private hospitals. Domingo says the DOH is responsible for the distribution of COVID-19 vaccine supply, which is being administered currently for healthcare workers. FDA regulatory officers are continuously investigating illegal COVID-19 vaccination.
This cannot be sold, and no patient can be charged for using them. But even after this batch of vaccines, once all of the vaccines that we bought are coming in, or even vaccines na will be procured through tripartite agreements, it must be clear that vaccines cannot be sold. Walang commercial sale ng vaccines.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The League of Provinces of the Philippines opposed the Department of Health's recall for the allocated vaccines in the provinces to be given to medical frontliners in Metro Manila. Meanwhile, DOH Secretary Francisco Duque III clarified that the redeployment of vaccines on places with low COVID-19 cases is not mandatory. Marvin Calas reports why.
Vaccines allocated in provinces are handful to be abated. League of Provinces President and Marinduque Governor Presbitero Velasco Jr. said, as much as possible, the national government should have a dialogue with the local government units if they would allow the recall on their appropriated vaccines, adding that LGUs also desire to reach herd immunity.
Kulang din po sa lalawigan, kaya po medyo palagay ko po ay hindi kami payag. Ngayon, kung gusto naman pong pumayag kung papayag po yung LGU, okay din po na ibalik yung bakuna sa DOH para sa NCR.
Instead of getting its benefit, Velasco worries that the vaccines might be wasted.
Konti lang naman po yung bakuna na binigay sa amin at kulang na kulang. At baka po masira pa yun kung ibabalik . So, kailangan lang po talaga makakuha sila ng maraming bakuna pa para sa Metro Manila. At nandiyan na naman po yung mga nagsusupply .
Health Secretary Francisco Duque clarified that the vaccine redevelopment is temporary as being borrowed.
Wala naman. Yan ay kakausapin ko sila, papaliwanag ko lang na hihiramin lang muna natin kung pwede para nang sa ganon yung mga pinakanangangailangan mapagbigyan. Yun lang yun.
Vaccine czar Carlito Galvez Jr. also opposes the Department of Health's move and plans to have a dialogue with Secretary Duque. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
WHO representative to the Philippines, Dr. Rabindra Abeyasinghe, says that one of the possible causes of the rise in COVID-19 infections in the country is vaccine optimism. Aiko Miguel will tell us why.
The arrival of COVID-19 vaccines and rollout gave people hope to get through this pandemic. This is why, according to World Health Organization Country Representative Dr. Rabindra Abeya Singha, it seems that the public became complacent, causing prominent rise of COVID-19 cases.
One factor is what I would like to call vaccine optimism. It's the fact that the arrival of the vaccines and the optimism that the vaccines brought have resulted in a decreased compliance with the public health measures. It's not a noticeable decrease, it's small changes at individual level, but at a community level, it has meant that it has opened room for the virus transmission to increase. So what that means,
Dr. Abeya Singha says it is not enough to just rely on the protection COVID-19 vaccines can give. People should still observe minimum public health standards, as these are considered as first line of defense against COVID-19.
But this infection has demonstrated again that we have to be very careful. We have to do everything that we need to do to ensure that we suppress this infection on the longer term.
WHO advises the public to be vigilant, especially with the existence of COVID-19 variants in the country, particularly in NCR, where COVID-19 transmission is fast and widespread. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Most local government units are no longer requiring RT-PCR test results from residents going home to their provinces. Asher Kadapan Jr. tells us why.
The League of Provinces of the Philippines favors the provision to not require COVID-19 tests to arriving travelers so long as they are residents of the receiving local government unit, including locally stranded individuals or LSIs and non-authorized persons outside residents or non-APORs. LPP President and Marinduque Governor Presbitero Velasco Jr. says most provinces adopt the policy, but some local government units are still requiring them. Based on the Interagency Task Force on the Management of Emerging Infectious Diseases or IATF Resolution number 101 issued in February 2021, COVID-19 testing is no longer mandatory unless required by the LGU of the traveler's destination. Governor Velasco, however, clarified that the policy are not for domestic tourists not residing in the province of their destination.
Iba-iba po yung posisyon ng LGU dyan, pero generally po, yung sa travelers lang po, foreign or domestic, yan po yung mga travelers na hindi nakatira sa loob ng lalawigan, kailangan po yung PCR test. Ngayon yung regulasyon ng RESO 101 ng IETF ay hindi po kailangan doon sa mga residents talaga, yung mga non-APORs at saka LSI.
Although RT-PCR may no longer be required, travelers residing in the province of their destination should undergo clinical and exposure assessment in the receiving LGU. They also need to secure a travel coordination permit in their respective office of the governor to be informed of their arrival date. For non-resident tourists, a certificate of negative result for reverse transcription polymerase chain reaction or RT-PCR test 3 days prior to the date of their trip may be required by the receiving LGU. The LPP has already recommended to the IATF to allow them to conduct COVID-19 testing upon entry of the travelers.
Kung bibigyan po kami ng option to use it, gagamitin po namin either saliva test or antigen test. Pero kadalasan po antigen test ang maganda dahil yan po ang mga saliva test ay kailangan po may Red Cross na facility. Karamihan po ng lalawigan wala akong facility at mas mahal. Yung antigen test po ay mura at mabilis po nakukuha yung resulta within 10 minutes. Mas preferred po yun ng LGU.
The LPP advises travelers to contact the receiving LGU prior to traveling to make sure of the additional requirements they may need to prepare before their trip. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The country's COVID-19 treatment czar encouraged the public to practice enhanced health standards, including the wearing of 2 face masks. Janice Inhente will tell us why.
Health Undersecretary Leopoldo Vega admitted that the transmission of COVID-19 in the country is getting out of hand. The DOH reported today more than 7,000 new confirmed infections, an all-time high since the local outbreak began. With this, Vega urges the need to enhance the minimum public health standards by observing double masking or wearing two masks. According to experts, double masking is equivalent to using an N95 mask with 95% filtration ability against airborne particles.
More important is how we are going to respond to the crisis right now. If we are able to make sure that the public adheres to minimum health standards, and ayaw ko na sabihin minimum, you have to enhance it. If there is a double masking, you have to double mask, you have to do all of the things that minimum health standard requires.
However, according to Health Secretary Francisco Duque III, using a single face mask combined with a face shield is enough to protect someone against the virus.
Kahit na isang face mask na basta may face shield, malaki na ang protection niya at saka physical distancing kayo, sa more than 90% protection. So, laking bagay.
The DOH does not recommend the wearing of two masks for those with chronic lung conditions such as asthma, chronic obstructive pulmonary disease, emphysema, and others. Duque inspected some public markets in Metro Manila to check if they are following the health protocols. The Health Secretary advises customers and food stall owners to limit talking while dining in.
Matapos kumain, balik po kaagad ha. Huwag na makipag-usap.
Vega reminded Filipinos to remain in well-ventilated areas and to avoid long interactions with other people. He also cited the importance of social hygiene and avoiding crowded places. Janice Enhente, UNTV, News and Rescue. We serve the people, we give glory to God.
A waste and pollution watchdog group has sounded the alarm over the reckless disposal of single-use face masks worn to safeguard against COVID-19. JP Nunez will tell us why live. Yes, JP?
Harleen, the Eco Waste Coalition appealed to the Interagency Task Force on Emerging Infectious Diseases to direct all local government units to enforce the proper disposal of soil-disposable masks. The group warned that improper disposal of face masks, which contain respiratory droplets of people who wore them, may endanger the health of others who pick them and then touch their own faces. The group emphasized that LGUs should impose an ordinance for the proper segregation of used medical protective gears.
On the level naman po ng mga LGU and of course national government natin ay lakasan pa yung pag-implement ng proper waste segregation ng related waste. At the same time, sana ay magkaroon pa sila ng clear action steps paano i-handle to in a national level.
The group further suggested that the public should lessen their activities outside to avoid using disposable masks.
Ngayon nakikita natin na patuloy pa rin at lalong lumalala yung COVID-19 natin. Unfortunately, ay tumataas pa rin yung mga COVID-related waste natin. And gusto namin na, of course, yung paglaban namin sa environmental efforts natin shouldn't come at the expense of public health. Pero maiiwasan naman natin yung paggamit ng mga to. Kunyari, pag hindi tayo lumabas or hindi tayo mag-dine in sa labas, ibig sabihin, kapag hindi tayo lumabas, ay mababawasan natin yung paggamit natin ng face mask or other COVID-related gears na disposable.
Earlier, the Department of Environment and Natural Resources, or DENR, has expressed alarm over the amount of healthcare waste, including face masks, that are ending up in Philippine seas. DENR Secretary Roy Simatu said they have received reports that single-use face masks were found entangled in coral reefs of Anilao, Batangas. DENR is working closely with the Department of Interior and local government, handling household healthcare waste, cleaning of esteros, and reminding those living near waterways not to throw waste directly in bodies of water. And that is our latest live. Back to you, Harleen.
Thank you, JP Nunez, reporting live. The Metropolitan Manila Development Authority, or MMDA, launched its first ever granulator and brick making facility as part of its bid to lessen solid waste being dumped and found in Metro Manila waterways. Marvin Calas has the story.
A 2016 study on Philippine solid waste suggests that an estimate of over 9,000 tons of waste is collected in Metro Manila. As a response, MMDA, with its 25-year waste management plan, inaugurated its granular and brick-making facility at Vitas Pumping Station in Tondo, Manila. MMDA Chairman Benhur Abalos said the facility offers great help in waste reduction because 70% of collected wastes are singular waste materials that is primarily processed by the granulator machines to produce byproducts such as eco-hollow blocks, bricks, eco-concrete barriers, and bio-waste compost materials.
This is a very good project and it promotes Filipino ingenuity because this is a Filipino patented machine. No? Talagang magaling po ang Pilipino. Anong pagkakaiba nito sa ibang granulators? Number one, it talks of quality. Matibay po ang lalagay na bricks dito because of this component, especially the plastic.
LGUs also expressed support and cooperation on MMDA's call in aid of the said project.
Making the facility which can serve as a model project for emulation by local government units in the Metro Manila. This is a pilot project and this can be emulated in all areas that we deem proper that this system will be constructed. As we know, we have 17 LGUs within Metro Manila.
Some residents are delighted following the facility's inauguration as a response to the waterways problems that causes flooding in the city.
Para sa akin lang ang solusyon yun kasi para makabawas talaga sa basura. Kung gagawin nilang environment na nung mga hollow block ganun, mas nakakatulong pa sa mamamayan.
Siyempre, hindi natin magiging problema kung saan dadalhin yung basura kasi recycle na siya. Hindi na natin maano yung brand, bigayong tambakan lang. At least mababawasan na ng basura, makakatulong pa, makakatipid pa yun.
MMDA clarified that the said project is not the ultimate solution on waste management, but rather it is just a model of the agency's innovative waste management. Being a responsible citizen is still essential and the appreciation on the importance of a clear environment is just necessary. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
The palace has clarified that the calls for the Duterte tandem are not from the government. Meanwhile, the Liberal Party has no official position yet for the newly formed coalition that will endorse a unified slate of the opposition. Arlene Delgado will tell us why.
The calls for the Duterte tickets in the 2022 elections do not come from the administration, according to the palace. Groups have been urging Davao City Mayor Sara Duterte Carpio to run for presidency with her father, President Duterte, as his vice president. Senator Panfilo Lacson also said in a television interview that the father and daughter tandem would be a bit too much and that Filipinos are not ready with the Davao-like political situation.
Hindi po galing sa gobyerno yan, Duterte to Duterte. Kung meron man po mga taong gobyerno nag-express niya, yan po yung mga personal na opinion po nila. Dahil ang mandato po ng presidente natin, tutok muna tayo sa pandemya, tsaka na yan politika.
Chief Presidential Legal Counsel Salvador Panelo earlier hinted about the tandem, noting that there are no legal issues that could hinder the two from running. The ruling party, PDP Laban, has continued its call for the president to run as vice president, despite the directive from their acting president, Senator Manny Pacquiao, to stop talking about politics. Meanwhile, in response to Senator Lacson's revelation that he has plans to run for the presidency, Senator Pacquiao has this to say.
Ang pagiging presidente ay destiny na kaloob ng Panginoon. Ngunit ang hangad ko sa sunod na maging presidente ay may tunay na malasakit at tunay na pagmamahal sa mamayang Pilipino. Tigilan na natin ang kulay politika.
Meanwhile, the Liberal Party has no official stand yet on the new coalition, Isang Bayan, which aims to field and support a unified opposition slate. The coalition said Vice President Leni Robredo, who sits as the Liberal Party chairman, is one of those being considered for possible national candidates.
Wala pang official stand ng Liberal Party. We are open to informal talks, but I think in the end, I would rather we focus first on how to overcome the current problem of the COVID management and the spread, and we can talk politics maybe 2-3 months before the deadline of filing.
Senator Nancy Binay is also being considered by the coalition. However, the senator says she is not running for higher office. Binay thanked the coalition for considering her as one of its possible candidates, but she says politics has been brutal to her family. The senator adds she cannot subject her family again to the ugly brand of politics, the sustained attacks, and the lies that stained and wounded them. For now, Senator Binay says she will continue her job as a lawmaker. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Supreme Court Chief Justice Diosdado Peralta stresses it is not easy to issue rules on the proposal of requiring law enforcers in the country to use body cameras while serving search warrants. Dante Amento tells us why.
Deliberation, debate, as well as inputs from various involved parties such as the Philippine National Police are needed before the rules on the use of body cameras among law enforcers are finalized.
We will invite the parties, we will also invite the police officer and have a debate on this so that when the rules come out, they will not say that this is biased to this is biased to this. We do not like that, no? The rules must be done and must be applicable to all persons without any bias or discrimination.
Supreme Court Chief Justice Diosdado Peralta says that the High Court must assure the legality and constitutionality of the rules before publication for implementation. Peralta also clarifies that using body cameras will amend the existing rules of court.
Now, if it is a body cam and therefore it amends the rules of court, we have to determine if there is a need to follow the procedure in order that it can become effective and legal and constitutional. Yung pang problema, hindi pwede, amend nyo yung rules na ganun. That's not easy.
Meanwhile, the Integrated Bar of the Philippines, or IBP, welcomes this effort by the High Court. IBP President Attorney Domingo Igon Cayosa says that using body cameras would protect not just the subjects in law enforcement operation, but also the operatives themselves.
By documenting it properly and accurately, protected yung subject against excessive use of force. Yung mga kapulisan naman, protected na babalik na rin sila. Baka sabihin na nakit sila o kaya nagnakaw, hindi naman totoo.
The use of body cameras is pushed by different groups to prevent irregularities in law enforcement operations. This comes after 9 activists died in separate police operations in Calabarzon region. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, French Prime Minister Jacques Castex announced a limited lockdown for Paris and other regions of the country as France faces a third COVID wave. Paul Gatchalian will tell us why live. Paul, how and when will this lockdown start?
Marielle, the lockdown in Paris and some parts of northern France will take effect tomorrow morning, Philippine time, and will last 4 weeks. The variant, which was first found in Britain, has been attributed to 75% of COVID cases in the country, as medical centers facing a lot of pressure, with France just recently recorded 35,000 new cases on Thursday. The restrictions will be imposed on 16 regions, including the Paris area. Barbers, clothing stores, and furniture shops will be closed, with the exception of bookstores and other establishments selling essential goods. Schools will remain open and people will be allowed to go outdoors within a 10-kilometer radius. Traveling outside of hard-hit areas will be prohibited and will only be allowed if there is compelling reasons to do so. The government is considering to extend its new restrictions to other regions if necessary to stall the spread of the virus. Meanwhile, the government will resume inoculation with the AstraZeneca vaccine now that the European Medicines Agency has confirmed its safety. Marielle?
All right, thank you for that update, Paul. Meanwhile, Malaysia has charged its glove maker for providing poor housing for its workers. Sher Yambao will tell us why.
Top Glove Corporation Berhad, the world's largest manufacturer of medical gloves, has been charged with 10 counts of failing to meet the minimum standards for their workers' accommodation set by the Labor Department. The authorities conducted investigations at several Top Glove accommodation units last November following an outbreak of COVID-19. The outbreak grew into one of the largest clusters with more than 5,000 workers testing positive in one of its factories near Kuala Lumpur. 10 of the accommodation sites for their foreign workers at Tasik Perdanganan, Tasik Mutiara, and Ipoh Perak were not certified by the Labor Department. If found guilty, the fine will be 50,000 ringgit, equivalent to 700,000 Philippine pesos for each charge. Top Glove, represented by its director, pleaded not guilty to all charges levied by the Sessions Court in the northwestern seat of Ipoh, Malaysia. Court hearings will resume on April 28. Seriam Bao, UNTV News and Rescue, Malaysia. We serve the people. We give glory to God.
An emotional hearing focused on the disturbing rise of Asian American hate crimes in the United States was held today by the House Judiciary Subcommittee. Marvi Delfin reports.
Following a wave of assaults that have coincided with the coronavirus pandemic, the House Judiciary Subcommittee on the Constitution, Civil Rights, and Civil Liberties held a hearing on discrimination and violence against members of the Asian American community. This is the first congressional hearing on anti-Asian hate that has been held since 1987. Judy Chu, chair of the Congressional Asian Pacific American Caucus and the first Chinese American woman to serve in Congress, said the Asian American community has reached a crisis point that cannot be ignored, especially after the Georgia shootings that left 6 Asian women dead on Tuesday. At the beginning of the hearing, the opening remarks of Republican lawmaker Chip Roy acknowledged the importance of the subject matter, but then focused on the Chinese government, including speaking out against the country's treatment of the Uyghur people and its mishandling of the COVID-19 situation. Several prominent Asian American lawmakers, scholars, and advocates, including actor and producer Daniel Day Kim, testified on Capitol Hill on the rise of attacks against Asian Americans, saying the rhetoric of former President Donald Trump and other Republicans have inflamed tension.
You may recall that the reason I was moved to speak then was because the House had just recently passed H.R. 908, condemning all forms of anti-hate Asian sentiment. But I was disheartened to find that for a bill that required no money or resources, just a simple condemnation of acts of hate against people of Asian descent, 164 members of Congress, all Republican, voted against it. And now here I am again, because as every witness in this hearing has pointed out, the situation has gotten worse.
Democrat Representative Grace Meng was also visibly emotional as she highlighted that Asian Americans have been fighting an additional virus of hate and bigotry due to terms such as China virus, the China plague, and even Kung flu. From March 2020 to the end of February 2021, more than 3,800 incidents of discrimination against Asian Americans have been reported to the organization Stop AAPI Hate. According to the Center for the Study of Hate and Extremism, this spike in hate crimes against Asian Americans rose by 149% in 2020 in 16 major cities compared with 2019. U.S. President Joe Biden is expected to meet with Asian American leaders today, as he is determined to be part of the solution and not part of the problem. Marvi Delfin, UNTV News and Rescue. We serve the people. We give glory to God.
Meanwhile, NASA has successfully ran a test on the largest rocket element they ever built, the core stage of the Space Launch System. Nina Bascon reports why.
The successful test, known as a hot fire, took place on Thursday at NASA's Stennis Space Center near Bay Street, St. Louis, Mississippi. This marks the second hot fire test in the final stage of a comprehensive assessment of the rocket's core stage prior to launching the Artemis 1 mission to the moon. Acting NASA Administrator Steve Yurchik said the Space Launch System's core stage generated more than 1.6 million pounds of thrust within 7 seconds during the test, citing the SLS as the only rocket capable of powering next-generation missions to the moon. 4 of the core stage's powerful RS-25 engines were fired for a little more than 8 minutes, which is how they are expected to run during every Artemis launch to the moon. Various operational conditions were also tested, including moving the 4 engines in specific patterns and powering them up to 109% power, as they will during flight. The first hot fire test was conducted back in January 16, where NASA determined that a second, longer test would be needed to verify the core stage design for flight after the first test ended earlier than planned. The core will be used for the Space Launch System's maiden flight, currently scheduled for late 2021, which will send NASA's next-generation crew vehicle, Orion, around the moon. Nina Bascon, UNTV News and Rescue. We serve the people. We give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Mariel Latoza, live from Perth, Australia. Good evening.
A Filipino scientist is set to make history as the first Filipino to reach the third deepest spot on Earth. Mavian Dog will tell us why.
Dr. Deo Florence Onda from the University of the Philippines Marine Science Institute, or UPMSI, joins the Emden Deep Expedition scheduled on March 22 to 28. The group will try to reach Emden Deep, located in the Philippine Trench. This is the third deepest spot on Earth, which is approximately 10,400 meters or 34,100 feet deep. According to the UPMSI, Dr. Onda was invited by the Caledon Oceanic, noting that deep-sea expeditions like this are equivalent to the first early flights into outer space, and that it would be a major historic achievement as most records are held by foreign scientists or explorers. They will be diving Emden Deep on board the DSSV Pressure Drop, the only marine vessel in the world capable of carrying humans and repeatedly diving to the deepest parts in the world's oceans. Dr. Onda, who is already aboard the vessel, will be joined by Victor Vescova during the expedition, who is the current record holder of the deepest manned descent in the Marianas Trench in 2019. The UPMSI further stated that this endeavor can spark passion for young Filipinos who would want to make a career in the sciences and bring more attention to the conservation of the Philippine marine environment. Dr. Onda hopes to wave the flag of the Philippines in the Emden Deep, which is located in the Philippine Trench, to highlight its national significance and as a gesture to the Filipino people. Mavian Dog, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, March 19, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.